Bonjour, bienvenue à tous à cette conférence de presse. Je suis Boris Proulx, journaliste au Devoir, et je serai le modérateur de cette conférence. Hello, I'm Boris Proulx, reporter for Le Devoir, and I'll be moderating this press conference. We'll have a few questions in the room. We'll have first few remarks from the speakers, and then questions from the room, and then we'll go on Zoom, so you can please feel free to use the raise hand function at any point during this press conference, so I can hand you the mic afterwards. Vous pouvez utiliser la fonction lever la main à tout moment durant cette conférence de presse pour que je puisse vous donner la parole durant la période de questions. So we have on stage Dr. Supriya Sharma from Health Canada, Dr. Marc Bertillon de Santé Canada, Dr. Theresa Tam from the Public Health Agency of Canada, Howard New, de l'Agence de santé publique du Canada, et Dr. Matthew Tunis, National Advisory Committee on Immunization. On that, doctors, you have the floor, and we'll go to the question period after.
Thank you. Merci. Good morning. Thank you for joining us today. Before I begin, I'd just like to acknowledge that Canada is the homeland of First Nations, Inuit, and Métis people, and that we are gathering in Ottawa on the unceded traditional territory of the Algonquin and Anishinaabe people. Today I'm here to talk to you about Health Canada's authorization of the new Moderna Spikevax COVID-19 vaccine targeting the Omicron XBB.1.5 subvariant. We have authorized this vaccine for people 6 months of age and older. The vaccine was authorized after an independent and thorough scientific review for safety, efficacy, and quality. And this included a review of data from several studies of the primary series and booster doses of the Spikevax vaccine collected over the past 2 years. After assessing all the data, we've concluded that there is strong evidence showing that the benefits of this vaccine outweigh the potential risks. Individuals who are 5 years of age and older should receive 1 dose of the vaccine, regardless of their COVID-19 vaccination history. And children between 6 months and 4 years of age should receive 2 doses if they have not previously been vaccinated with the COVID-19 vaccine. And if they have been previously vaccinated with 1 or more doses, they should receive a single dose. This vaccine is anticipated to provide a robust immune response that will be effective against the Omicron XBB.1.5 variant. Health Canada is also actively reviewing submissions from Pfizer BioNTech and Novovax seeking authorization of the respective XBB.1.5 COVID-19 vaccines. These submissions are being reviewed on a priority basis by dedicated scientific teams. Timing for the completion of these reviews depends on many factors. We will make decisions once we have thoroughly evaluated all of the required information. Health Canada continues to use rigorous and independent scientific processes to ensure all health products meet our stringent requirements for safety, efficacy, and quality before allowing them on the market. And as with all of Health Canada's vaccine and drug authorizations, we want to stress that we only examine the most robust scientific evidence from trusted and reliable sources. We recognize that there's an abundance of information available that's sometimes false and exaggerated. We encourage people to consider their sources of information very carefully. As we did with all our COVID-19 vaccines, we're publishing a number of documents about this decision, including the Canadian Product Monograph and the Regulatory Decision Summary, which provides a high-level summary of the evidence that we reviewed. All of this information is available on the Government of Canada's main COVID-19 website. Health Canada and the Public Health Agency of Canada will monitor for any adverse events in collaboration with the provinces and territories, international partners, and manufacturers. As with all vaccines, we will take action if any new safety issues are identified. Today's authorization provides people in Canada with more protection against COVID-19. I know we all wish COVID-19 no longer existed, but people are still getting infected, and vaccination continues to be one of the most effective ways to protect ourselves against serious outcomes, including severe illness, hospitalization, and death. Vaccine protection decreases over time, which means many of us are due for another dose. Receiving a shot of the new formulation will help protect people against the variants circulating currently and expected to circulate through the fall and winter. Thank you. Merci. Miigwech.
Bonjour. Merci de vous joindre à nous
Good morning.
aujourd'hui.
Thank you for joining us
Avant de
today.
commencer, j'aimerais souligner que le
Before I
Canada
begin, I would
est la
like to
patrie des
acknowledge
Premières
that
Nations,
Canada
des
is the
Inuits et des
homeland of
Métis,
First
que nous
Nations,
sommes réunis à Ottawa
Inuit,
sur le
and
territoire
Métis people, and that we
traditionnel
are
non
gathering
cédé
in
du peuple
Ottawa on the
algonquin
unceded traditional
Anishinaabe.
territory of the Algonquin Anishinaabe
Aujourd'hui, je
people.
suis ici pour vous parler
Today
de
I'm here to talk to you
l'autorisation de
about
Santé
Health
Canada
Canada's
concernant le nouveau
authorization
vaccin
of the new
Spikevax de
Moderna
Moderna contre la
Spikevax COVID-19
COVID-19 qui cible
vaccine
le sous-variant
targeting the
Omicron
Omicron
XBB.1.5.
XBB.1.5
Nous avons autorisé
subvariant.
ce vaccin pour les
We have
personnes de 6 mois et
authorized this
plus
vaccine
à la
for
suite d'un examen
people 6
scientifique
months of age
indépendant
and
et
older.
approfondi de
The
son
vaccine was
innocuité, de
authorized
son
after an independent
efficacité
and
et de
thorough
sa qualité.
scientific review for safety,
Cette
efficacy,
évaluation
and
a notamment
quality.
porté sur
This
les données
included
de
a review
plusieurs
of data
études
from
sur la
several
vaccination
studies
primaire
of the
et des
primary
doses de
series
rappel de
and
vaccin
booster doses of the
Spikevax qui ont
Spikevax
été
vaccine
recueillis au cours
collected
des 2
over the
dernières
past 2
années.
years.
Après avoir évalué toutes les données, nous
After
avons conclu
assessing
qu'il
all the
existe des
data,
preuves
we have
solides
concluded that
montrant
there
que
is
les
strong
avantages de ce
evidence
vaccin
showing that the
l'emportent sur les
benefits of
risques.
this vaccine outweigh the
Les
potential
personnes de
risks.
5 ans et plus devraient recevoir une dose du
Individuals who are
vaccin,
5
quels
years
que
of
soient leurs
age
antécédents de
and older should
vaccination contre
receive
la
one dose of the
COVID-19.
vaccine
Les
regardless of
enfants
their
de 6 mois à
COVID-19
4 ans
vaccination
devraient
history.
recevoir 2 doses
Children between
s'ils n'ont
6
jamais
months
été
and 4
vaccinés
years
contre
of
la
age should
COVID-19.
receive 2 doses
S'ils
if
ont
they
déjà
have not
reçu
previously
une ou
been
plusieurs
vaccinated with
doses,
a
ils devraient
COVID-19
recevoir
vaccine.
une seule dose.
If they have been previously
Ce vaccin
vaccinated with
devrait
1 or more
fournir une
doses, they
forte
should
réponse
receive a single
immunitaire
dose.
efficace
This
contre le
vaccine is
variant Omicron
anticipated to provide a robust immune
XBB.1.5.
response that will be effective
En
against
outre,
the
Santé
Omicron
Canada examine
XBB.1.5
activement les
variant.
demandes
Health
d'homologation de
Canada
Pfizer
is also
BioNTech
actively
et de
reviewing
Novavax
submissions
pour leur
from
vaccin contre la
Pfizer BioNTech
COVID-19
and
ciblant
Novovax
le
seeking
variant
authorization of their respective
XBB.1.5. Ces demandes
XBB.1.5
sont examinées
COVID-19
selon les
vaccines.
priorités
These
par des
submissions
équipes
are being
scientifiques
reviewed on a
spécialisées.
priority basis by
Le
dedicated
moment où ces
scientific
examens
teams.
seront complétés dépend
Timing
de
for the
nombreux
completion of
facteurs. Nous
these
prendrons des
reviews depends
décisions
on many
une fois que
factors.
nous aurons évalué
We
en
will make
profondeur
decisions
tous
once
les
we have
renseignements
thoroughly
pertinents.
evaluated all of the
Santé
required
Canada
information.
continue
Health
d'utiliser un
Canada
processus
continues to use
scientifique
a
rigoureux et
rigorous and
indépendant
independent
pour s'assurer
scientific
que tous les
process
produits
to
de
ensure
santé répondent à
all
des
health
exigences
products meet our
strictes
stringent
en matière
requirements
d'innocuité,
for
d'efficacité et
safety,
de qualité
efficacy,
avant
and
d'autoriser
quality
leur mise en
before allowing
marché.
them on the market.
Comme c'est le cas pour toutes les
As
homologations
with
de
all of
vaccins
Health
et de
Canada's
médicaments de
vaccine and
Santé
drug
Canada,
authorizations,
nous tenons à
we
souligner
want
que
to
nous
stress
n'examinons
that
que
we
des données
only examine
scientifiques
the most
solides
robust
provenant de
scientific
sources
evidence
fiables
from
et dignes de
trusted and
confiance.
reliable
Nous
sources.
savons qu'il existe beaucoup de sources
We
d'informations
recognize
sur
that
le
there is an
sujet,
abundance of
dont certaines
information
font
available,
circuler de fausses
that it is
informations ou
sometimes
des
false
exagérations.
and
Nous
exaggerated.
invitons les
We
gens
encourage
à
people to
évaluer
consider
soigneusement
their
la
sources of
crédibilité de leurs
information
sources
carefully.
d'information. Comme nous l'avons fait avec tous les autres
As we
vaccins
did
contre
with
la
all
COVID-19,
other
nous allons
COVID-19
publier un
vaccines,
certain
we
nombre
are
de documents
publishing a
sur cette
number of
décision,
documents about this
notamment la
decision,
monographie
including the
canadienne et le
Canadian
sommaire
Product
de décisions
Monograph and the
réglementaires, qui
Regulatory
fournit un
Decision
résumé
Summary,
détaillé
which
des données
provides a
examinées.
high-level summary of the evidence
Tous
that
ces
we
renseignements
reviewed.
sont disponibles
All
sur
of
le
this
site web
information is
principal sur le
available on the
COVID-19
Government
du
of
gouvernement
Canada's
du
main
Canada.
COVID-19 website.
Santé Canada et l'Agence de
Health
la
Canada
Santé
and the
publique du
Public Health
Canada
Agency of Canada
effectueront le
will
suivi des
monitor
effets
for any
indésirables
adverse
qui pourraient
events,
se manifester en collaboration avec
and
les
this in
provinces et les
collaboration with the
territoires, les
provinces and
partenaires
territories,
internationaux et les
international
fabricants.
partners, and the
Comme pour tous les
manufacturer.
vaccins, nous allons prendre des
As with
mesures
all
si tout nouveau
vaccines, we will
problème
take action
d'innocuité
if
est
any
mis
new
au jour.
safety issues are identified.
L'autorisation d'aujourd'hui fait en sorte que
Today's
la population
authorization
canadienne
provides
sera
people in Canada
davantage
with more
protégée contre la
protection against
COVID-19.
COVID-19.
Je sais que nous aimerions tous
I
et
know
toutes
we
que
all
la
wish
COVID-19 soit chose
COVID-19
du
no longer
passé, mais le
existed,
virus
but
continue
people are
d'infecter
still
les
getting
gens
infected,
et la
and
vaccination demeure
vaccination
l'un des
continues
moyens
to
les
be
plus
one of the
efficaces pour nous
most
protéger
effective
contre les
ways to
conséquences
protect
graves,
ourselves
y
against
compris les
serious outcomes,
complications de la
including
maladie,
severe illness,
l'hospitalisation ou la mort.
hospitalization, and death.
La protection vaccinale diminue avec
Vaccine
le temps,
protection
ce qui
decreases over
signifie que
time,
plusieurs d'entre
which
nous
means
devraient
many of us
recevoir une
are
nouvelle
due for
dose.
another dose.
Recevoir le nouveau
Receiving a
vaccin
shot of the
aidera
new
à protéger la
formulation will
population
help
contre les
protect people
variants qui
against the
circulent
variants
actuellement
circulating
et qui
currently
devraient circuler
and
à l'automne
expected to
et à
circulate
l'hiver.
through the fall
Merci.
and winter. Thank you.
Bonjour à toutes et tous. Today, I
Hello,
will
everyone.
provide an update from the National Advisory Committee on Immunization, or NACI, on the use of COVID-19 vaccines this fall and an overview of our expectations for the upcoming respiratory virus season. With today's authorization, NACI is reaffirming its guidance on the use of COVID-19 vaccines this fall. NACI recommends authorized age groups get an updated COVID-19 vaccine dose this fall, 6 months after their last vaccine dose or infection. Provinces and territories will be providing additional information on COVID-19 and seasonal flu vaccine availability in their respective regions. We will have enough supply of the updated COVID-19 vaccines funds to support immunization programs across Canada. From the start of 2023, COVID-19 indicators had been on a decline to historically low levels for a number of months. In the last few weeks, We have started to see an increase in COVID-19 indicators across many areas of the country, including hospitalizations. The Omicron variant continues to evolve, with XBB subvariants such as EG.5 continuing to circulate in Canada and globally. Canada has also reported 11 cases of the Omicron subvariant BA.2.86. Here's some good news. Preliminary clinical data have shown promising immune responses from the XBB.1.5 vaccine, the vaccine receiving regulatory authorization today, against various Omicron sublineages, including EG.5 and BA.2.86. This improved immune response is expected to better protect against the strains that are circulating in our communities. It has been more than 6 months since your last dose of COVID-19 vaccine or your last infection, your protection from the virus may have waned. Receiving a COVID-19 vaccine dose this fall with an updated formulation is expected to increase individual protection against infection, symptoms, and severe disease. This is particularly important for people at increased risk of severe outcomes, such as people 65 years and older, individuals with underlying medical conditions, pregnant people, and those living or working in congregate living settings. Vaccination in combination with personal protective measures are integral tools to reduce the negative impact of respiratory illnesses. This is especially important as we head into the colder months, when people spend more time indoors and the risk of respiratory illness increases. Last year, Canada experienced an early and intense influenza season during a time of high circulation of the respiratory syncytial virus, or RSV, putting increased strain on already stressed healthcare systems, particularly the pediatric healthcare system. It is difficult to predict what will happen this fall and winter regarding the co-circulation of influenza, RSV, and COVID-19, given that it is still early in the season. But the good news is we can get prepared and protect ourselves in case simultaneous surges of respiratory viruses occur. This is why receiving a COVID-19 vaccine dose, as well as a flu shot this fall, is especially important. It is safe to receive COVID-19 and flu vaccines at the same time. These vaccines will help to keep us from getting seriously ill and, by extension, reduce the burden on our health systems. Treatments can also help to reduce serious illness posed by COVID-19. The Government of Canada is funding Can Treat COVID, a clinical trial with sites across Canada to evaluate treatments like Paxlovid for acute COVID-19 infection. You can find out more information at cantreatcovid.org. Everyday personal protective measures such as staying home when sick, cleaning your hands frequently, properly wearing a well-fitting mask or respirator, and improving ventilation as possible remain effective strategies to reduce the spread of respiratory viruses, especially when combined with vaccination. With children now back in school, check to make sure their routine vaccines are up to date for their age. Immunization remains the #1 action we can take to protect children from serious infectious diseases. For older adults, it's important to remember that during the fall and winter months, people over the age of 65 are at greater risk for other infections too, like bacterial pneumonia. So if you're in this age group, now is also a good time to discuss getting the pneumococcal vaccine with your healthcare provider. With these tools in mind, I encourage everyone to take action to stay safe this respiratory virus season. Merci. Thank you. Miigwech.
Bonjour à toutes et à tous. Je présenterai aujourd'hui une mise à jour provenant du Comité consultatif national de l'immunisation, ou CCNI, sur l'utilisation des vaccins contre la COVID-19 cet automne, ainsi qu'un aperçu de nos prévisions pour la saison des virus respiratoires qui approche. Avec l'autorisation d'aujourd'hui, le
With
CCNI
today's authorization,
réitère
the
ses
NACI is
recommandations
reaffirming
concernant
its guidance on the use
l'utilisation
of
des vaccins
COVID-19
contre la
vaccines this
COVID-19.
fall.
Le CCNI recommande que tous les
NACI
groupes d'âge
recommends authorized
autorisés
age groups get an
reçoivent une nouvelle
updated
dose de vaccin
COVID-19
contre la
vaccine dose
COVID-19
this fall,
cet automne,
6
6 mois après
months
leur dernière
after their
dose
last
ou
vaccine
une
dose
infection
or
à la
infection.
COVID-19. Les provinces et territoires communiqueront des
Provinces and
renseignements
territories will be
additionnels sur les
providing additional
disponibilités des
information
vaccins
on
contre la
COVID-19
COVID-19
and
et la
seasonal
grippe
flu
saisonnière
vaccine
dans leurs
availability
régions
in
respectives.
their respective
Nous
regions.
disposerons d'une quantité suffisante
We will
de
have
nouveaux vaccins
enough
contre
supply
la
of the updated
COVID-19 pour
COVID-19
soutenir les
vaccines
programmes
to
de
support
vaccination
immunization
partout
programs
au Canada.
across Canada.
Depuis le début de 2023, les indicateurs de
From the start of
COVID-19 ont atteint des
2023,
niveaux historiquement
COVID-19
bas, et
indicators
ce,
have been on a
pendant plusieurs
decline
mois.
to historically low
Au cours
levels
des
for a
dernières
number of
semaines,
months.
nous avons
In
commencé
the
à
last few
détecter
weeks,
une
we have started to
augmentation
see an
des
increase in
indicateurs de la
COVID-19
COVID-19,
indicators
comme les
across many areas of
hospitalisations
the country,
dans plusieurs
including
régions au pays.
hospitalizations.
Le variant Omicron continue d'évoluer avec des
The
sous-variants
Omicron variant
XBB tels
continues
que
to
le
evolve with
E.5 qui
XBB
demeure en
subvariants
circulation
such
au
as
Canada et dans le
EG.5
monde.
continuing to
11 cas de
circulate in
sous-variants
Canada and
Omicron
globally.
BA.2.86
Canada has reported 11
ont également
cases
été
of Omicron
signalés au
subvariant
Canada. Les données cliniques préliminaires
BA.2.86.
montrent des réponses
Preliminary
immunitaires
clinical data
prometteuses
have shown
avec le
promising
vaccin
immune
contre le
responses
sous-variant
from the
XBB.1.5.
XBB.1.5
La nouvelle
vaccine,
formulation du vaccin
the vaccine receiving
autorisé
authorization today
aujourd'hui
against
contre
various
divers sous-variants,
sublineages,
notamment
including
le EG.5 et le
EG.5 and
BA.2.86.
BA.2.86.
On anticipe que cette réponse immunitaire
This
améliorée
improved immune
procure une meilleure
response is
protection
expected to
contre
better
les
protect
souches qui
against the
circulent
strains that we are
présentement
seeing
dans
circulating in
différentes
our
régions du
communities.
pays. Si plus de 6 mois se sont écoulés depuis
If
votre
it has been
dernière
more than
dose de
6
vaccin
months since your
contre la
last dose of
COVID-19
COVID-19
ou votre
vaccine
dernière
or your
infection
last
au
infection, your
coronavirus,
protection
il
from
se
the
peut
virus
que
may have
votre
waned.
protection contre le virus ait diminué. Le fait de recevoir cet automne une dose de nouveau
Receiving a
vaccin contre
COVID-19
la
vaccine dose
COVID-19
this fall
devrait
with an
augmenter
updated
votre
formulation
protection
is expected
contre
to increase
l'infection,
individual
les symptômes
protection
et
against
les
infection,
complications découlant
symptoms,
de la
and severe
COVID-19.
disease from
Cette mesure
COVID-19.
est particulièrement importante pour les personnes
This
plus
is particularly
susceptibles
important for
d'être
people
gravement
at
malades
increased
en
risk
raison de la
of severe
COVID-19,
COVID-19
comme les
illness,
personnes âgées
such
de
as
65
people
ans
65
et
years
plus,
and older,
les personnes atteintes de maladies
individuals with
sous-jacentes,
underlying
les
medical
personnes
conditions,
enceintes et les
pregnant
personnes
people,
qui vivent ou
and
travaillent
those living
dans
or
des milieux
working
de
in
vie
congregate
collectifs.
living settings.
La vaccination et les mesures de protection individuelle sont des
Vaccination
outils
in combination
essentiels
with
pour
personal
réduire les
protective
effets
measures are
négatifs
integral
des maladies
tools to reduce the
respiratoires.
negative
Ils
impacts
sont
of respiratory
particulièrement
illness.
importants à
This is
l'approche des
especially
mois plus
important
froids,
as we head
où
into
les
the colder
gens passent
months
plus de
when people
temps
spend
à
more time
l'intérieur
indoors
et
and the risk of
où le risque de
respiratory
maladies
illness
respiratoires
increases.
augmente. L'année dernière, le Canada a connu une saison grippale
Last year,
précoce
Canada
et intense
experienced an
pendant
early
une période
and
de
intense
propagation
influenza
élevée
season during
du
a time of high
VRS,
circulation
mettant
of
à rude
RSV,
épreuve les systèmes de
putting
santé
increased strain
déjà
on
très
already stressed
sollicités,
healthcare
en
systems,
particulier le système de
particularly
soins
the pediatric
pédiatriques.
healthcare system.
Il est difficile de prédire comment se dérouleront
It is difficult
l'automne
to
et l'hiver
predict what will
prochains
happen this
en ce
fall
qui
and winter
concerne la
regarding the
propagation de la grippe,
co-circulation of influenza,
du VRS
RSV,
et de la
and
COVID-19, étant
COVID-19,
donné que la saison ne fait que
that it is
commencer.
still early in
Mais
the season.
heureusement, nous pouvons nous
But the
préparer
good news
à
is we can
l'éventualité
get
des
prepared
vagues
and protect ourselves in
simultanées
case
de
of
virus
simultaneous
respiratoires
surges of
pour nous
respiratory
protéger.
viruses occur.
C'est pour cette raison qu'il est particulièrement important de recevoir une dose de vaccin
That's
contre la
why receiving a
COVID-19
COVID-19
ainsi qu'un
vaccine
vaccin
dose as
contre
well
la
as a
grippe
flu
cet
shot
automne.
this fall
Il est en
is
effet
especially
sécuritaire
important.
de recevoir ces deux
It is
vaccins
safe to
en même
receive
temps.
the COVID-19
Ces
and flu
derniers
vaccines
nous
at the
aideront
same
à ne
time.
pas tomber
These
gravement
vaccines will
malades
help keep us
et,
from getting
par
seriously ill
conséquent,
and,
à
by
réduire les
extension,
pressions
reduce the burden
exercées
on our
sur nos
healthcare
systèmes de
systems.
santé. Des traitements peuvent également contribuer à
Treatments
réduire
can
la
also help
gravité
to
de la
reduce serious
COVID-19.
illness posed by
Le gouvernement du
COVID-19.
Canada
The government of
contribue
Canada
au
is
financement
funding Can Treat
COVID,
COVID,
un essai clinique
a clinical
comptant
trial
plusieurs sites à
with
travers le
sites
pays
across
qui a
Canada
pour
to
but
evaluate
d'évaluer
treatments
des
like
traitements pour l'infection
Paxlovid
aiguë à la
for
COVID-19
acute
tels
COVID-19
que
infection.
Paxlovid. Vous trouverez plus d'informations
You can
sur le
find more
site
information at
cantreatcovid.org. Les
cantreatcovid.org.
mesures de protection individuelles,
Everyday
comme rester à
personal
la maison
protective measures,
lorsqu'on est
such as
malade,
staying home when
se
sick,
laver les mains fréquemment,
cleaning your hands
porter
frequently,
un masque bien
properly,
ajusté
wearing
et
a
améliorer
well-fitting
la
mask or
ventilation
respirator,
autant que
and
possible
improving
demeurent des
ventilation as
stratégies
much as possible
efficaces pour
remain
réduire la
effective
propagation
strategies
des
to
virus
reduce the spread of
respiratoires,
respiratory
en particulier
viruses, especially when
lorsqu'elles sont
combined with
combinées à la
vaccination.
vaccination. patients. Maintenant que les enfants sont de retour à l'école,
With children now
assurez-vous
back
que
in
leurs
school,
vaccins de
check to
routine
make sure their
sont à
routine
jour en
vaccines
fonction
are up
de
to
leur
date for their
âge.
age.
La vaccination demeure le meilleur
Immunization
moyen
remains
de
the number one
protéger
action
les
we can
enfants
take to protect
contre les
children
maladies
from serious
infectieuses graves.
infectious diseases.
Quant aux personnes âgées de plus de 65 ans, il
For
est
older
important de
adults,
se
it's
rappeler
important to
que
remember that
pendant
during the
l'automne
fall
et
and
l'hiver,
winter
elles
months,
sont plus à
people over
risque
the
de
age of
contracter
65 are
d'autres
at greater
infections
risk of other
comme la
infections
pneumonie
too,
bactérienne.
like bacterial
Si vous
pneumonia.
faites partie de ce groupe
So
d'âge,
if you're in
il
this
serait
age group,
bon de
now is a
discuter
good
de
time to
vaccins
discuss
contre les
getting the
pneumocoques avec
pneumococcal
votre médecin.
vaccine with your
En
healthcare provider.
conclusion, j'encourage tout le
With
monde à
these tools
prendre
in
les
mind,
mesures
I
de
encourage
prévention
everyone to take
des
action to
infections
stay
pour
safe
rester
this
en
respiratory
sécurité
virus
pendant
season.
la saison des virus respiratoires. Merci. Thank you. Miigwech.
I believe it's time for questions. So we'll go first in questions in the room. I recognize two reporters, and then we'll go on Zoom. Vous pouvez utiliser la fonction lever la main à
And then
partir
on
de
Zoom, you
maintenant
can use
pour
the raise hand
avoir
function
le
now
micro. So we'll go first with
show that you would like to
Mia
speak.
Rapson,
We'll start with
Canadian
Mia
Press.
Rapson, Canadian Press.
Good morning, afternoon, whatever time of day it is today. I'm just wondering, Dr. Tam, if you can give us some more information on the current situation with COVID. We've heard about this uptick. Where are we at sort of in comparatively? And are the vaccines now going to come at a time that will actually help this fall? Or by the time we actually get them into arms and they take effect, will it be too late to slow whatever wave we're seeing right now?
Yeah, so right now, we have been seeing this uptick of COVID-19 activity in wastewater in some areas of the country, but that's a little unstable. It's gone up, and then in some areas it's come down as well. So, but overall, the COVID indicators are still at quite low levels, and low to moderate in some areas. So we're just at the beginning, I think, of this fall-winter circulation. So it's not too late to get COVID-19 vaccine and the flu shot, even throughout the season, particularly as we're trying to prevent serious outcomes as well.
Thank you. And I'm going to put a whole bunch of questions into this one. So are you able to get this vaccine at the same time as the flu shot? Is that something that would be recommended or possible? Do we know if they will still be free or if some provinces are going to have to make that decision? And also, in terms of uptake, the bivalent uptake was relatively low compared to the original or the primary series. What are we trying to do to overcome that, and what do you think can overcome that?
Thank you. So the provinces and territories, for the most part, are planning to be able to provide both vaccines at the same time. And so that may increase access and uptake, make it more convenient for people. So one visit, two vaccinations at the same time. And as I've said in my opening remarks, it is safe to provide both vaccines at the same time as well. And in terms of some of the data that we have on surveys that we conducted on vaccine coverage, as well as on public opinion surveys as well, is that one of the reasons, for example, that people didn't, say, get the flu shot was because it was kind of inconvenient for them, and they didn't get around to it, was one of the reasons. And so if we are essentially in the jurisdictions trying to link up both vaccination program, it may just make it a little bit easier. Of course, long-term care facilities and other high-risk settings will likely be the focus for the initial provincial territorial programs, just as they do with influenza vaccines. And I think provinces and territories will be providing further information on the start dates of those programs. And so you should check in with your local jurisdiction. The federal government is continuing to provide the COVID-19 vaccine. We are also providing support for the high-dose influenza vaccine for long-term care as well.
Following up with the
It's
Marina
Dr.
Fund.
New, maybe I could just add points in terms of the issue of vaccine uptake. So there's lots of things that we've learned over the past 3 years. One of the things that the Government of Canada is also doing is I think we're spending up to $10 million with what we call the Immunization Partnership Fund to actually encourage initiatives that would increase vaccine uptake among maybe certain groups at risk that may not to have maybe the same access to the vaccine as others. We've also learned that there's multiple ways to basically give Canadians the information they need. We think by and large Canadians respect, understand the science, but they need multiple sort of channels to be able to get that information. So providing tools, for example, to the frontline providers such as their family physicians, also reaching out to trusted leaders in the community, be it faith-based influencers. We're looking at sort of a multi-pronged approach rather than just, quote, having a few talking heads here sitting at a press conference. Thanks.
Apologies for that. Next question is from Marina von Stackelberg, CBC.
Hi there, good afternoon. You don't have the word booster here. I wanted to know, is that intentional, and are you wanting Canadians to change the way they look at getting the COVID vaccine?
I think we wanted to emphasize this is an updated COVID-19 vaccine. And similarly, we update influenza vaccines as well. And it will increase, getting an additional dose will increase your immunity, antibody levels, and also increase vaccine protection against serious outcomes. It's a matter of terminology, but I think we're trying to standardize and simplify some of the various terms at the moment. I know perhaps Dr. Sharma has a take on that, and Dr. Tunis as well.
Yeah, thank you, Dr. Tam. So yes, there's been lots of discussions amongst regulators around terminology. And so there's an internationally agreed upon simplified dosing schedule now. So we won't see the words primary series as much or booster. And it's not quite stabilized yet, but the idea is that we'll get to a place where it may be much like the flu vaccines, where people may be on a regular schedule getting an updated vaccine. And so really, I think there's more benefit just talking about the latest vaccine or the updated vaccine rather than going back to years ago when we were talking about your very first 2 doses or speaking about boosters. I don't mind the word booster because it actually does talk about what the vaccines, additional doses of the vaccines do for the immune system. They take it from a place where that immunity might be waning a bit and boost it up to a higher level. So I don't mind that terminology, but again, it's really to simplify the overall dosing schedule and the way that we talk about it.
Yeah, I can comment from the advice we've received from NACI. The committee is, I think in their statement, they maybe make mention to booster a couple of times, but generally we're seeing a transition towards that additional dose language in line with the regulator and the authorized monograph. And there's discussion about those that are previously vaccinated, which we historically would have thought of as boosting, and then those that are previously not vaccinated. So the first dose or the primary series. And you'll see in the regulatory materials that there's that distinction between previously vaccinated or previously unvaccinated. And NACI is mirroring that in their advice and the way that the schedule discussions are going. One thing I'll note is that with this authorization for Moderna today, the NACI advice is updating, onboarding Moderna into the recommended options for this fall. We don't have the others yet. So Pfizer or Novovax are both submitted and under review by the regulator, and they might have slightly different schedules as they have so far for the previously unvaccinated or the primary series. So NACI has been working through the summer trying to look at all the products. We only have one today with Moderna, but as the others come through, we would expect future updates from NACI around what we had previously called the primary series, or for someone coming new into the vaccine schedule who was not immunized before, can NACI provide a sort of simplified, harmonized approach across the public health system for the different products. So they're continuing to work on that, and we'll see more updates coming in the coming months, I think, as more products are authorized, maybe with slightly different schedules or different nomenclature, and the committee will be onboarding that to try and make things as simple as possible, because we appreciate that the COVID-19 vaccine, environment has been complex at times, and so the regulator and NACI are both seeking to simplify as much as possible in the language and the schedules.
Thanks for that. What is the timeline here? When can Canadians expect to actually be able to go and receive this shot?
Yes, so with the regulatory authorization, the manufacturer, in this case Moderna, will start mobilizing vaccines to Canada, and most provinces and territories are planning to begin the COVID-19 programs at around the same time as the influenza programs. So we expect they're probably aiming for the beginning of October or thereabouts, but that will vary a little bit, so you do have to check locally.
Thank you. Merci. On va maintenant passer sur les questions sur Zoom. Vous pouvez utiliser la fonction lever la main à partir de maintenant. So you can use the function raise hand at this point, so I can recognize you on Zoom. First question on Zoom is from Megan Deller, CTV News. You have the floor.
Hi, and good afternoon. What are Health Canada's greatest concerns around the latest variants detected in Canada?
So this is Theresa Tam from the Public Health Agency. I'll take the first go at that question. So as I said in my remarks, the Omicron variant, these are all the subvariants of Omicron. Those new ones that you've been hearing about, all descendants of the Omicron variant itself. So and that is expected, actually, for a virus that's circulating in or around the world. And so we're monitoring these viruses quite closely through various means and connecting with international partners. So far, none of the recent subvariants of Omicron have demonstrated increased virulence or severity. I think there was just some latest data coming from the United Kingdom on the BA.2.86 as well, related to a outbreak. So that's generally good. None of the recent variants seems to result in more severe outcomes. But that doesn't mean that with increase in cases, you wouldn't get a significant burden on the health system or on population health. So I think it is really a matter of ongoing monitoring. But the other good news, of course, that we've also mentioned is that we expect the updated XBB.1.5 vaccine to mount antibody responses that are similar to these newest variants as it is done against the XBB.1.5. So that's good news as well.
And to add from the Health Canada
Thank
side,
you.
Oops, sorry. Is that okay if it's Supriya Sharma, if I could just add a couple of points, is that right?
Go ahead.
I'll take that as a yes. So, I mean, I guess the question of what do you worry about? When we're at Health Canada is everything. We're professional warriors. That's our job. But when it comes to the mutations and the variants, it's twofold. So one is when you see these mutations, especially when you have variants that are what we call highly mutated, the question will be whether or not the vaccines that we currently have or we're reviewing or approved would have effectiveness against those variants. And as well, the tests that we have, whether it's rapid tests or other tests, whether or not they would pick up and detect those variants. So, the concern really around some of the new variants was primarily around BA.2.86 because it was so highly mutated. It seems that I wouldn't say it's a nothing burger, but it doesn't seem like it's the one that would dominate at this point in time. And thankfully, we do have data to show that the current vaccines that we are reviewing and the one that we've approved does have effect against all of the variants that we're sort of seeing that are dominating currently. Same thing with the tests. We go to the manufacturers of the tests to get data on whether or not these new variants are able to be detected by the rapid tests. We're still in the process of looking at that data and getting that data in. And if there are any concerns, obviously, we will communicate that.
Follow up, Megan?
Thank you. And is there any evidence to suggest that symptoms and transmissibility are less severe in these latest variants than we typically see?
So according to some laboratory data, and there, there's not a whole lot of them at the moment, the BA.2.6 subvariant appears to be less able to infect cells. So that gives us a little bit of a clue, which is also good news, but we have to monitor that quite closely as well. And I think, as I said, there does not seem to be any evidence to date that these new subvariants are causing any different range of symptoms or increased severity.
Prochaine question est de Mylène Crête de La
Next
Presse.
question, Mylène Crête from La Presse.
Oui, bonjour. Je vois que vous portez tous
Yes,
un
I
masque là,
can see
pour vous
that you're all
protéger.
wearing
Est-ce que
a
c'est
mask
quelque
today
chose
to
que vous
protect
comptez
yourselves. Is this
recommander?
something
Est-ce
that
qu'on
you're
pourrait
planning on
revoir le
recommending?
port du masque
Are we
obligatoire?
going back to mandatory masks?
Merci pour la question, c'est Dr. New.
Thank you for the
Oui,
question. This is
qu'on a
Dr.
constaté à plusieurs reprises, je pense que le port de
Yes.
masque bien ajusté, c'est une
I
des
think
mesures
wearing a
de
mask
protection
is
individuelle,
one of
comme une
the
autre couche de
personal
protection, c'est
protective measures
combiné
that
avec
is just
les autres
another
bonnes mesures
level
comme
of protection that
se
we can
laver les mains
combine with
fréquemment,
other
rester à la
practices
maison
such
si
as
on est
frequently
malade,
washing your
mais
hands,
aussi à
staying
combiner
home
avec
if
la
you're sick,
vaccination, avec
and as well as
le
getting
nouveau
vaccinated,
vaccin. Je
getting
pense que
the
tout ça
new
ensemble,
vaccine. I think
je pense
we need to
que va
combine
nous
all of
porter dans
this
une bonne place,
together, and
peut-être
that
pour pas
will
trop, comme
lead
dit,
us
mettre de
to
pression
a
sur
better
nos
place
systèmes de santé
to make sure
partout
that
au
we're
pays,
not
parce qu'on a
overburdening
vu
our healthcare
avec
system.
l'hiver passé, on a
We
vraiment
saw
eu beaucoup
last winter that there
de
was
pression
a
sur
huge
le
uptick
système de soins de santé
in
avec
pressure
le
on our healthcare
VRS,
system
le COVID-19 et aussi
with
la grippe. Donc, je
RSV
pense que c'était
and
important cette année
COVID-19. And so I think
d'utiliser
this
toutes
year
les
it's very
mesures
important
disponibles.
that we
Ça veut dire
implement all possible
recevoir le
measures
vaccin contre
to
le
prevent this.
COVID-19,
So one of
aussi
those
la
things
grippe,
is
mais
getting
aussi
vaccinated
le port
against
de masque, comme
COVID-19
dit,
and the
d'une façon
flu
prudente.
and
Merci.
wearing a mask.
Donc, si je comprends bien, c'est
So if
qu'on
I've
vous
understood
laissez
correctly,
ça à la discrétion de chaque personne là, de
this will
choisir
be
s'ils
an
veulent porter un
individual
masque ou pas.
choice for people, whether or not they want to wear a mask.
Oui, pour le moment, je pense que
Yes, for the time
quand
being.
vous avez constaté avec les exigences de masque, ça c'est au passé quand vraiment
We are no longer
personne
mandating that people wear
comme dit,
masks.
protégé contre
Right
le
now, it's an
COVID-19. On est
individual
comme tout
choice
le monde été
for
susceptible
people
au
who
début
want
de la
to
pandémie avec comme
protect
dit la
themselves,
phase
who
aiguë de la
are more
pandémie.
susceptible
Maintenant,
to
avec comme
catching
dit
COVID.
l'immunité un peu hybride avec
Right now, we
l'infection,
have
aussi
hybrid
avec
immunity. That
beaucoup de monde
means,
qui sont déjà
people have
vaccinés.
either been
Je
vaccinated or
pense que
have
on est dans
had
une
COVID-19
autre
or
place, on
both.
peut dire que
And so I
on
would
sait
say
que
that
c'est
now the situation is different.
une bonne mesure de protection
That being said,
individuelle.
it is, like I
C'est
said, a good
efficace.
personal
Et je
protective
pense que
measure.
c'est
It
vraiment
is
pour les Canadiens
effective.
aussi de réfléchir que
And I think it's
c'est pas
important that
nécessairement seulement
Canadians
une mesure de protection individuelle,
see that
mais
it's
aussi
not
une
just a
façon de
personal
démontrer
protective
aux autres
measure, but it's also a way to
on
protect
prend
other
soin
people.
les uns des autres parce qu'il y a toujours
we need to be
des autres
taking
dans
care of each
notre
other.
communauté, dans notre société qui sont
And
plus
thinking about our
susceptibles comme
communities and
peut-être
those
par
in
exemple
Canada
les personnes
who are
immunodéprimées, les
more
personnes âgées. Donc je pense
susceptible
que
to
le
becoming
port de masque
seriously
c'est
ill,
aussi
those
peut-être
with
aussi quelque
lowered immune
chose
systems, for example,
pas
or
seulement pour
underlying
les
medical
personnes
conditions. And
qui
so
décident de
mask wearing
porter
is
pour
a
eux-mêmes, mais
decision that
aussi
can be
pour les
made
autres.
for yourself, but also for others.
Next up, Theresa Wright, iPolitics.
Hi there. My question is for Dr. Tam. Less than 6% of Canadians have received a booster in the last 6 months, according to the latest data online. How concerned are you about Canadians' protection against COVID-19?
So we're in a very different situation than we were, of course, during the early moments of the pandemic. Based on some of the studies that have been conducted, we know that really close to 80% of people in this country, certainly in the adult population, may have already got infected, particularly in the post-Omicron era, on top of having had two of the initial doses, quite a high vaccine coverage. We know immunity does decrease with time. So I think part of the reasons that we think there's an increase in uptick right now is this reduced immunity over time, which is why there's a recommendation to get the updated vaccine if it's been 6 months since your last infection or vaccination. I think the spring booster, we have always felt that that's probably going to not be the highest uptake. By that time, I think it's really the people at the highest risk who is most interested in getting an additional dose. Activity was coming down at that time as well. So, but for this upcoming respiratory virus season, we anticipated that there's a likely increase that we're going to see, which was just beginning at this point, together with the other respiratory viruses. So we are absolutely encouraging people to get protected, both with COVID-19 vaccine and the flu shot, prior to the period ahead. And so, but we'll still be monitoring the effectiveness of these vaccines over the season. And NACI will keep a close eye on, if necessary, further vaccine recommendations.
And just as a follow-up, you talked earlier about getting prepared ahead of the flu season, but here it is mid-September. School's already started for some time now, and we haven't been hearing from public health officials like yourselves, in quite some time. I'm wondering why we haven't been getting more regular updates on whether it's updated advice on vaccines or on the newest variants, and whether the reason that we're not hearing more is because of concerns about political backlash.
Well, I think we haven't been doing a lot of press conferences, but we're providing data on an ongoing basis on our website, for instance, and doing individual interviews as needed. But we have been having a really historically low levels of COVID-19 activity. The first time we've seen that really since the start of the pandemic, from January until more recently. I think this is a really opportune moment to make sure that we come out with our key messages because of the authorization of the updated vaccine, as well as provinces and territories are beginning to gear up for their flu and COVID-19 vaccinations. So I think we're glad to be here and answering your questions at this time. I think flu vaccine programs have generally, in province and territory, start in October. People usually get vaccinated between October and November timeframe. We have a fairly long fall winter season, of course, in Canada, and you can still get viruses and viral activities like influenza until April. So again, it's never too late to get your vaccines.
Prochaine question, Michel Sabat, la presse
Next
canadienne.
question, Michel Sabat,
Oui,
la presse
bonjour.
canadienne.
J'aimerais faire du pouce sur la
Interpretation will not be
question de
provided
ma
for the
collègue
current
Mylène
speaker
Crête.
because an appropriate
Donc, vous
microphone is
portez
not being
tous
used.
un masque en ce
Interpretation will
moment et
resume
je
as soon as an
comprends
appropriate
que c'est
microphone is
bien
used.
et que vous en avez peut-être porté un tout l'été à la piscine. Mais aujourd'hui, recommandez-vous sérieusement à la population de reprendre les habitudes de la pandémie et de recommencer à porter un masque cet automne, ou vous le voyez simplement comme un plus qui n'est pas absolument nécessaire?
Merci pour la question encore. C'est Dr. New de
Thank you
l'Agence
for
de
the
santé
question.
publique
This
du
is
Canada.
Dr. New from
Je
Public
pense
Health
qu'on
Canada.
est dans une meilleure situation aujourd'hui
I think we're in a better
comparé comme au
situation
début de la
today
pandémie, parce que
compared to
maintenant,
at the beginning of the
comme j'ai
pandemic.
constaté, on a l'immunité hybride.
As we can see,
On a
we
beaucoup
have
plus de
hybrid
connaissances.
immunity.
On est
Now,
plus
we
près
have a
avec
lot
les
more
vaccins
knowledge
maintenant
of the
aussi avec
situation, and we've
beaucoup
moved forward
des
with
autres
vaccines.
outils aussi. On sait c'est quoi
And we have a lot
les
of other
mesures de
tools
protection
as well.
individuelle
We
qui
know
sont
more
efficaces.
about
Si on
personal
parle
protective
des
measures
masques
that
bien
are very
ajustés,
effective.
je pense que c'est à ce moment, c'est comme dit, un choix personnel. Mais
wearing a
comme j'ai dit,
mask, like
c'est
I
aussi,
said,
je
is a
pense,
personal
qu'un choix
choice.
personnel que j'espère que tout le monde
But it is a personal
est conscient
choice
que c'est pas seulement
that
une
I hope
mesure,
people will
on prend
realize
seulement pour
is
se protéger, mais aussi peut-être
not
protéger
just
les
for
autres. Si on est dans
oneself, but
comme
for
un
others as well.
environnement, on parle toujours en anglais avec les 3 C, mais en français,
So in
je
English,
pense
we talk about the 3 Cs.
l'acronyme BEC, c'est les lieux
We use a
bondés,
different
comme
acronym in French.
le contact étroit et les espaces clos.
But we're
Donc,
talking
je pense
about
que c'est
closed
une
spaces
bonne
and
peut-être
close
une façon de
contact.
c'est ici. On se trouve dans un contexte contexte comme ça, c'est peut-être une bonne idée. C'est aussi si on habite avec peut-être des personnes âgées, aussi peut-être des personnes plus à risque, c'est aussi une bonne idée peut-être de continuer avec une bonne habitude. Mais je pense aussi, si on parle des exigences, moi je suis au courant que dans quelques lieux comme par exemple les hôpitaux, je pense que quelques sections des hôpitaux, comme peut-être la section qui reçoivent peut-être les patients de cancer, c'était toujours la politique. Ça continue. Je parlais peut-être avec une collègue dans une province et c'est toujours été de la politique, ça continue. Et même maintenant, je pense ici même à Ottawa, que l'hôpital d'Ottawa aussi a recommencé avec une politique, une exigence pour toutes les personnes qui travaillent ou qui visitent à l'hôpital. Donc, je pense que c'est pas pour nous autres, je pense que c'est les décideurs, les personnes qui gèrent les lieux comme les hôpitaux, peut-être les autres lieux aussi, mais je pense que comme une bonne pratique de protection individuelle, je pense que si on considère tous les facteurs de considération, tout le monde va prendre une bonne décision et faire un bon choix personnel. Merci.
D'accord, merci, docteur. Et puis, ces vaccins contre la COVID seront-ils ou devraient-ils être gratuits?
La question, peut-être je n'ai pas bien compris.
Les vaccins contre la COVID, est-ce qu'ils seront ou devraient-ils être gratuits?
Avec les vaccins, je pense que pendant les 3 premières années de la COVID-19, c'est sûr que le gouvernement du Canada pays fournit tous les vaccins sans frais pour les provinces et les territoires. Mais je pense que si on regarde qu'est-ce qui se passe au passé, mais même actuellement pour tous les autres vaccins, je pense que c'est toujours, comme on dit, une entente, une situation où les provinces et territoires, normalement, sont responsables pour leur propre vaccin, le médicament dans leur système de soins de santé. Et le gouvernement fédéral, on aide par, je ne sais pas en français, mais avec, comme dit, le pouvoir de l'achat collectif. On dit le bulk procurement, on a toujours commandé un mécanisme pour avoir le meilleur prix disponible pour les provinces et territoires. Donc, je peux seulement parler de ce qui se passe actuellement, mais je pense que c'est quelque chose à suivre au futur si on parle pas seulement pour les vaccins contre la COVID-19, mais en total tous les vaccins médicaments dans les systèmes de soins de santé des provinces et territoires.
Merci, thank you. I notice there are 2 reporters from City News that request to ask questions, so I don't know if it's a mistake, but I'll start up with, okay, I notice. It will be Xiao Li from City News. Please go ahead.
Hi, thanks for taking my question. So I wanted to ask about rapid tests, given that much of what was already in Canadian inventory has expired, and given the expected next wave, is Canada going to be purchasing more rapid tests for distribution to provinces, or is there going to be guidance on use of expired tests? What's the plan here?
So the federal government still has rapid tests in the stockpile, basically, but has stopped sending out any rapid tests to provinces and territories upon discussion with them, because they feel that they have what they needed. And in general, it's not really appropriate to use expired tests. I'm looking at the regulator. All I would say is if you use any rapid test, just a reminder that if it's negative, it may not mean you don't have COVID. The key is to probably do serial testing if you think you have COVID and you get a negative test. If you get a positive test, it's likely that you have COVID and you can take the necessary precautions. But there's no specific plans to purchase more from the federal government at this point in time.
And just to add to that, with respect to the expiry dates for the tests, so basically the expiry dates are based on the data that were submitted at the time that those tests were authorized. If the company has additional data to show that they could be used beyond that date, then they'll provide that to Health Canada. We will review that. And if that then gets extended, will have a new expiry date for those products. And all of those lots and the names of the devices and the tests are all on the Health Canada website. So you can check which ones have been extended and what the current expiry dates are and if they've been extended to what date.
Thanks for that. Just as a follow-up, and sorry to cut you off, but I just wanted to take note. You're all masking, which is lovely to see, of course, but most government ministers are not now. Most MPs are not. Most people on the street are not masking. Is there any specific guidance on that going forward at this point?
Yes, Theresa Tam. So it is a layer of protection. We hope people have developed the habit to be able to use masks as needed during the respiratory virus season, not just for COVID, but for all the other respiratory pathogens that will be transmitted around this time. So I do think now is the time to get your masks ready if you don't already have them. In our own particular context, we certainly in our area, there's been an uptick in some of the COVID-19 indicators. For me personally, there have been cases around, even my work colleagues. So that's one of the reasons why we are wearing masks today.
Merci, thank you. I see no more questions on Zoom, mais je vais utiliser mon privilège de modérateur, si vous le permettez, pour terminer avec une petite question. Beaucoup de Canadiens, depuis 3 ans maintenant, presque en décembre, est avec nous les vaccins sur la technologie mRNA. Probablement que beaucoup de Canadiens ont vu sur leurs réseaux sociaux des anecdotes ou peut-être des rumeurs concernant ce vaccin-là. J'aimerais savoir maintenant que nous avons les spécialistes devant nous et un peu de temps, est-ce que la technologie des vaccins mRNA a causé des décès, beaucoup de décès parmi les personnes qui l'ont reçu dans les 3 dernières années?
Amongst those who have received this type of vaccine in the last 3 years?
Okay, moi, je peux commencer aussi, passe la parole à mon collègue, Dr. Berthiaume. Je pense avec l'expérience, vraiment à l'échelle mondiale, on a des millions, des centaines de millions de doses de vaccins déjà administrés aux gens. Et jusqu'à date, c'est sûr, il y a toujours quelques cas. On examine s'il y a comme des effets secondaires. Mais je pense qu'en général, je peux dire que oui, les vaccins sont très sécuritaires, sont efficaces. C'était vraiment un miracle de science, d'après moi, qu'on a vraiment développé si rapidement. Les bons vaccins qu'on a vraiment bien utilisés. Et c'est vraiment quelque chose que je pense qu'avec l'expérience de date, je pense que j'ai aucune préoccupation avec la technologie. C'est bien établi et je pense qu'on va continuer au futur
these vaccines, and I hope that in the future we will be able to continue using this type of mRNA technology. And now I will give the floor to my colleague, Dr. Berthiaume.
Pour ce qui est des vaccins à ARN messager,
so in terms of mRNA vaccines,
nous disait qu'on utilise
like
depuis
Dr. New
plusieurs
said,
années,
this is technology that we've been using for several
associé à des
years.
craintes, quoique les principes derrière l'ARN messager étaient développés depuis plus qu'une décennie.
Now,
pour des
this
médicaments,
technology
pour le
was
cancer,
developed about a decade ago in relation to cancer medication.
Dans les vaccins,
but for the general population, it is new.
La fabrication de produits thérapeutiques. Puis, ce qu'on a vu avec l'ARN messager, c'est que c'est un vaccin qui offre des grandes possibilités de créer une immunité, mais aussi d'être modifié et puis rapidement, relativement facilement, puis de rentrer ça en production. Donc, on voit par l'annonce d'aujourd'hui que la flexibilité de la technologie à laquelle on faisait référence lorsqu'on parlait de ce vaccin-là, cette technologie-là, est en place, puis là, on voit qu'on peut adapter le vaccin. Donc, cette flexibilité-là pour des pathogènes qui évoluent à travers le temps, comme le virus de la COVID-19, est particulièrement intéressante. Votre question portait aussi sur l'innocuité.
In terms of safety,
s'il y a des décès qui ont été reliés à ça ou pas, c'est toujours difficile à dire. dire. Mais on peut prendre, par exemple, l'exemple de la myocardite. Il y a des cas de myocardite qui sont rapportés chez les gens qui font la COVID-19. Il y a des cas de myocardite qui ont été rapportés suite à des vaccins. Mais ce qu'on voit dans toutes les études, c'est que le risque est beaucoup inférieur des cas rapportés après une vaccination, par exemple, qu'après la COVID-19. Donc, est-ce qu'on peut dire qu'il y a des produits de santé avec un risque zéro? Non, même l'acétaminophène comporte des risques de santé. C'est toujours l'approche sur les produits thérapeutiques. Est-ce qu'il y a plus d'avantages que d'inconvénients pour une personne à prendre un produit de santé? Puis pour les vaccins, avec toute l'information qu'on a développée, avec toute l'expérience qu'on a, avec tous les essais cliniques qui ont été faits, je pense qu'il y a des grandes quantités d'évidence qui démontrent les bienfaits.
So much evidence that shows the benefits of these vaccines that outweigh these very rare risks that can exist
donc, quand les gens prennent la décision de prendre le vaccin, il faut qu'ils considèrent l'ensemble des risques et bénéfices. On peut dire qu'il n'y a aucun risque à aucun produit de santé, y compris les vaccins à ARN messager, non. Mais quand on regarde, est-ce qu'il y a plus de bénéfices que de risques à se faire vacciner pour la COVID-19 avec les produits qu'on a, puis compte tenu maintenant de l'expérience, si on y pense, il n'y a pas beaucoup de produits dans le monde qui ont été aussi utilisés que les vaccins à ARN messager, puis très étudiés dans les dernières années avec toutes les capacités qu'on a à étudier les données. Donc, le profil d'innocuité est très connu, très rassurant, vraiment bien, puis toutes les données sont publiées, les informations sont accessibles sur le site de Santé Canada. It's accessible on Health Canada's website. You can look at qui demeure comparativement au nombre de personnes qui prennent le vaccin,
side effects and how common they are.
très, très basse.
Mais à votre connaissance, le nombre de cas confirmés de décès, c'est 0.
But as far as you're aware, we have 0 confirmed cases of death associated with mRNA vaccines.
Au niveau de la surveillance des vaccins, dire faire le lien entre un vaccin et un décès, c'est quand même
making that link between
un exercice
a
assez
death
compliqué.
and mRNA and
les
a
décès
vaccine
surviennent dans la
is
population
very difficult to
générale.
do.
Si un vaccin qui est pris puis quelqu'un décède, il peut avoir une
someone
association
takes the vaccine,
temporelle. Ça ne crée
and
pas une
passes
association
away,
causale. Fait qu'à ce
we're
moment-là,
unable
au niveau
to
des vaccins,
establish
il faut que chaque cas
link
soit
of
étudié
causation.
individuellement. Mais ce n'est pas un risque important associé au vaccin,
there
le
is
risque
no
de décès. Je
serious
pense que
risk
si on met ça, les décès
these
peuvent survenir de
vaccines
façon naturelle,
terms
puis le
of
décès
risk
peut
of
survenir beaucoup plus
So,
par rapport à la COVID que par rapport au vaccin.
It's much more likely
Fait que
that
je
death
pense que
occurs
dire que
because of
les vaccins contre
COVID-19 and not the
COVID-19
vaccine.
comportent un risque de décès à ce moment-ci, basé sur les données qu'on a. Si le risque existe, il
Based
est
upon the
infinitésimal.
data that we have,
Docteur,
the
merci
risk
pour votre temps.
is
That puts an end
so
to this press
small.
conference.
Thank you very much.
Oh. Go ahead, Mia.
I just wanted to follow up. I'm just wondering why we're not recommending 2 doses for people over 5 who haven't been primarily vaccinated before, and if that means we're completely done with the original series or not.
Yeah, so for the authorization, the reason that it's only the 1 dose is that's how it was studied. So that's what the trials were supporting, is that in somebody that had they basically looked at, there's mice models, but also in the clinical studies, if somebody had the booster doses, and then they would look at the response as well. And then there's some studies in terms of the overall sort of response. So we moved away, as we said, from the primary series. It doesn't mean that you would be one and done if you've never been vaccinated, but we also have the majority of people that have been infected as well. So it's a combination of potentially there's a very high rate of people that would already have some hybrid immunity. So 1 dose likely is sufficient, and then we'll see what will happen as we go into the future, and if we do need regular updated vaccines after that.
That's everything. That puts an end for real to this press conference. Thank you very much to all.